Yours is on.
Good afternoon. We are welcome to the Health Committee hearing of what is today, the 12th. Have some announcements before we begin. First of all, we will hear two witnesses per side with a time limit of 3 minutes each for each item. Additional witnesses, please only state your name and organization for the record and your position on the measure. We have a proposed consent calendar. Items number 10, Assembly Bill 2119, Mr. Chu, C-H-U, is proposed for consent, as is AB 2696, Gaines, and AB 2747, Hadley. At this time, we've had 3 bills removed from the hearing. AB 2108, Waldron, which will be heard on April 19th. AB 2439, Nazarian, which will also be heard on April 19th, and AB 2782, Bloom. So at this point, we're going to be convening as a subcommittee. As you can see, we don't have a quorum. And I would like to have our first author present, Mr. Ridley Thomas. The floor is yours, AB 2345. Thank you very much.
Thank you, Mr. Chairman, colleagues.
He's not on.
Presenting AB 2345, which would establish a commission on healthcare cost review to study and analyze policies impacting costs and access to healthcare coverage. As a member of the Little Hoover Commission and the Select Committee on Mental and Behavioral Health, I've learned how independent analysis aids public policy. This healthcare cost review study and commission will be valuable to the legislature. It will require a report from this commission to study healthcare costs and how we might bend the cost curve further and ensure equal access to healthcare. With that, I would respectfully request an aye vote.
Do we have witnesses in support, Mr. Ridley Thomas?
I don't know that they're in the room at the present.
Okay.
I believe that we have physicians in support.
Okay. Anybody in opposition? Anybody in between? Seeing no one. Questions from the committee? Mr. Meanshine.
Mr. Ridley Thomas, thank you for bringing this bill. I'll be happy to move it once we have a quorum. Thank you.
Thank you so much, Mr. Vice Chair.
So thank you, Mr. Ridley Thomas. Once we have a quorum, the bill will be moved, and we appreciate you jumping in there.
Thank you.
Looking for other authors. Mr. Bonta. Are you ready, Mr. Bonta? So, Mr. Bonta, you have 2 bills before us, AB 1644 and AB 2216. What is your pleasure?
I may have a third as well. AB 1726?
Apparently I'm not counting very well here, so... Yes, you do. Thank you, Mr. Bonta. So,
thank you, Mr. Chairman.
Would you like to start with 1644?
That'd be great. Thank you.
Okay, thank you.
Thank you, Mr. Chair, members and staff. I'm proud to present AB 1644, a bill that will restore the early mental health initiative, which puts mental health professionals in schools to identify and prevent and heal the impacts of violence and trauma on children and youth. And one of the biggest public health challenges of our day is the issue of ACEs, adverse childhood experiences. And this bill addresses that issue head on by helping put resources in schools to help children who've been exposed to toxic stress, abuse, and neglect. And it focuses on children from preschool to 3rd grade. And we think this is a really important bill. We're also working on the funding component to help make this bill go, should it pass and move on through the legislative process. So pleased to present this to you today, Mr. Chairman and colleagues. And I have with me today Robert Sumner with the Attorney General's Office.
Great, thank you.
And they're a co-sponsor of the bill.
Great, thank you. Please proceed. Yeah.
Yes, good afternoon. The Attorney General is very proud to be a co-sponsor of this legislation along with Time for Kids and Children Now. We also have a long list of experts from the health realm, from the education realm, from the social services realm. So represented here today is the Attorney General's office uniquely from the public safety sector. The Attorney General has actually prioritized the further investigation and utilization of research into the ACEs epidemic that faces trauma-exposed young people, and the way that that can be one of the leading indicators to whether or not that child is likely to, in one way or another, interface with our juvenile justice system and eventually our adult justice system. So to keep my remarks brief, we are very proud to be here as a co-sponsor because we believe that this is probably one of the most effective methods that we possibly can to just improve the lives of both the state as a whole and our young people.
Great. Thank you. Just the one witness at this? Okay, great.
Yes, Mr. Chair.
Thank you very much. Others in support, please name an organization.
Linda Way with Western Center on Law and Poverty in support.
Thank you.
Thank you, Mr. Chair and members. Christopher Castrillo on behalf of the California Academy of Child and Adolescent Psychiatry in support.
Thank you.
Vanessa Kahina on behalf of the Nurse Family Partnership here in support.
Great, thanks.
Carolyn Cooper, United Advocates for Children and Families of California, a faith-based community.
Thank you. Any members, anybody in the audience in opposition? Anybody in between? See no one. Questions from the committee? Any questions or comments from the committee on this bill? Seeing none, I want to thank you very much, Mr. Bonter, for bringing this very important bill forward to us. We will not, once we have a quorum, we will actually go ahead and take a vote on this, but I'll allow you to go on to your next bill. I'm
Mr.
sorry.
Chairman?
Before I do that, did you accept the amendments on?
Yes, thank you. They
My
were
bad.
excellent amendments, and I appreciate staff's hard work on them.
Okay, thank you. Thank you very much.
So AB 1726, thank you, Mr. Chair, for allowing me to move on to this bill. This is the AHEAD Act, the Accounting for Health and Education and API Demographics Act, and it acknowledges what we know to be true, that the Asian American community is not a monolithic group, that it's made up of different subgroups that have different histories and cultures and languages and different experiences that have had different outcomes in both education and in health. And we believe that every one of those communities needs to be counted, and so data from those communities should be collected and measured and shared. And that's what this bill does. It requires the collection of disaggregated data for a number of categories that are already being used for collection of data in other departments within the state of California. And this bill would require that those same categories for data collection be used with our three higher education segments, CSU, Community College, and UC, as well as with the Department of Healthcare Services and Department of Public Health. And we have both the witnesses, right? I have with me today witnesses. I have Calvin Chang, Director of Policy for Empowering Pacific Islander Communities, and Autumn Ogden, Director of California State Legislation for the American Cancer Society Action Network. Thank you for your consideration. Respectfully ask for your aye vote.
Great, thank you. Please.
Mr. Chair, members, Autumn Ogden on behalf of the American Cancer Society Cancer Action Network. I'm here to support this bill. This bill will disaggregate demographic data for the API community and allow us to gain further insight to the individual needs for each of the API community. Although many of the communities within the API population face similar challenges, in California, such as language barriers and immigration, they differ on many issues, notably health. By relying on most often on the aggregated data of the API community, the state of California misses the needs of a growing ethnic subpopulations. When considering this bill from the cancer perspective, cancers among the API communities vary widely due to significant differences in exposure to cancer risk factors. For example, according to the 2014 report, A Cancer Journal for Clinicians, lung cancer rates in Samoan men are about 30% higher than those in Hawaiian, non-Hispanic white, and Laotian men, and almost 80% higher than in Asian, Indian, Pakistani men because of differences in smoking. For liver cancer, rates in Laotian and Vietnamese men are 2 to 4 times more higher than in the Chinese, Korean, and Filipino men, and almost 10 times higher than in Asian, Indian, and Pakistani men, who have the lowest rates. By requiring the information on the API community to be collected in a disaggregated way, we are able to more completely understand the unique health needs of these different communities and address those needs accordingly. I respectfully ask for your aye vote.
Thank you, members of the Health Committee. My name is Calvin Chang. I'm with Empowering Pacific Islander Communities. My organization partners with Native Hawaiian and Pacific Islander organizations across California to address disparities and improve health care outcomes and educational attainment rates. Accurate data is so important to our work in our communities that we partnered with over 40 different Native Hawaiian and Pacific Islander leaders and organizations throughout California to develop the first demographic profile of our community members in California. We strongly support this bill because the challenges faced by the Native Hawaiian and Pacific Islander community in California and other smaller communities are often ignored for lack of data or lumped under overly broad data categories such as Asian Pacific Islander or simply other. When this occurs, this hides the issues that we face and renders our communities invisible. By requiring the collection and the reporting of disaggregated health data, we can allow our policymakers, community organizations, and healthcare institutions and agencies to design more effective programs and conduct outreach and education campaigns that are actually relevant to our marginalized communities. Just as a brief example of the disparities that our community faces, the age-adjusted death rate for Native Hawaiians and Pacific Islanders in California is higher than that of any other race or ethnicity, with the exception of African Americans. And when it comes to the uninsured rate, Tongans and Fijians, who are both mentioned in this bill, have an uninsured rate that is nearly twice that of the state average. I thank Assemblymember Bonter for leading this effort to provide our state with the accurate portrait all of us deserve, and respectfully ask that the committee support this bill. Thank you.
Great, thank you. Others in support, just your name, organization. And
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, and strong support.
Thank you.
Thank you, Mr. Chair. Members, Christopher Castillo on behalf of the California Faculty Association in support.
Thank you.
Mr. Chair and members, Kimberly Chen with the California Pan-Ethnic Health Network in strong support.
Thank you.
Gina De Silva with the California Immigrant Policy Center in strong support.
Great.
Mark Masaoka, Asian Pacific Policy and Planning Council, in support.
Thank you.
Yolanda Benson, representing the California Asian Pacific Chamber of Commerce, in support.
Thank you.
Sarah Arce on behalf of the Campaign for College Opportunity, in support.
Michelle Cabrera on behalf of SEIU California in strong support.
Ian Rick John, Asian and Pacific Islander American Health Forum, in strong support.
Tu Quach with Asian Health Services in strong support.
Talofa, Tano Lepule with Empowering Pacific Islander Communities in strong support. Thank you.
Colombia Yakuto Personal NBC 1726.
Ye Vang. Her name is Ye Vang. She came to support AB 1726.
Thank you.
Colombia Hyunga. Kuto Personal Kuto support MB Koshan Goto.
Her name is Chia Zhang. She came to support AB 1726. She's from Fresno.
Thank you.
Hey, Kuya Chundua Sangla. Kuto Fesano Tua. Kuto Chanangata NBC Koshan Goto.
My name is Chu Dua. I came from Fresno. I came to support the AB 1726.
Thank you.
Kuya Chakuya. Kuya Vesno. Kutua Tajai Koshan Goto.
My name is Chaikua Yang. I came from Fresno. I came here to support AB 1726.
Thank you.
Kuya Nong Hyong Kuya Hupona. Kutua President Tuk to Churchet Goto Shalewa.
My name is Hugh Powell. I came from Fresno. I came here to support AB 1726.
Thank you.
Kuya Kia Lao Xiong. Kutua Chachai Koshan Goto.
I'm Kia Zhang. I came here to support AB 1726.
Thank you.
Kuya Kuto Fesino to Imi Kuya Chucha ya na nang.
I'm Chu Cheng. I came here to support AB 1726. Okay.
Thank you.
Kuya Shoha Kuto Fesino to Kuya Shoha Kuto Fesino to Utechachai MB no Koshan Goto.
I'm Shoher. I came here from Fresno. I came here to support AB 1726.
Thank you.
Kuya Moha Kuto Cha Chachai MB Koshan Goto.
More her. I came here to support AB 1726.
Thank you.
I'm Katao. I came here to support AB 1726.
Thank you.
Cú giờ máy xia li cú tốt chất trái chạy AB cổ xa nâng cổ trâu. Máy xia li.
My name is Mike Shua Lee. I came from Fresno. I came here to support AB 1726.
Thank you.
ข้าพเจ้าชื่อบุญทองอนุยิตบุญทอง
Bhutan. I'm Bhutan. I came here to support AB 1726.
Thank you.
Hi, my name is Baku. I came from Fresno. I came here to support AB 1726.
Thank you.
Hi, my name is Quinn Din, Executive Director with CRAC, Southeast Asia Resource Action Center, and strong support of AB 1726.
Great, thanks.
Good afternoon, Mr. Chair and members. I'm Santosh Siram Santana, representing the California Asian and Pacific Islander Budget Partnership, and we're in strong support. Thank you.
Thank you.
Cú giờ kia vu cú tua festival tua cú tua chơi trái chạy cổ xa năng cổ trâu.
I'm Kiavu. I came from Fresno to support the AB 1726.
Cú tua festival tua tua chơi trái chạy KB cổ xa năng cổ trâu. Yummy.
My name is Yang Mi. I came from Fresno. I came here to support AB 1726.
Thank you.
Cú yam đẹp trai của tôi phải xin nó tôi nữa nè nó của tôi sống cả nè nó MB và nè nó cầu xa năng cầu trâu.
I'm Blair Cheng. I came from Fresno. I came here to support the AB 1726.
Cú yam Lely đó, cú tôi phải xin nó California tua, cú tôi chơi trái chạy MB cầu xa năng cầu trâu. Cú yam Lely của tôi.
My name is Blair Lee. I came from Fresno, California. I came here to support the AB 1726.
Thank you.
Hello, we are Cheng Cheng. Good to such a Ningo Sha. Cheng Cheng.
My name is Cheng Shong. I came here to support the AB 1726.
Thank you.
We are Kuya Paku. Good to such a Ningo Sha.
My name is Pakuli. I came here from Fresno to support the AB 1726. I'm Kia Zhong. I came from Fresno to support the AB 1726. I'm Joa Zhong. I came here to support the AB 1726. My name is Claire Moore. I came here to support the AB 1726.
Thank you.
Cú số thọ, cú tôi phải xin nó tôi cú tôi chơi trái chạy MB cổ xa năng cổ trâu.
Okay. Thank you.
Số thọ.
My name is Shua Tao. I came from Fresno to support the AB 1726.
Cú giờ bạn cú tua nên là Fresno tua cú tua chơi trái chạy cầu xa nên cầu trâu.
My name is Sai Veng. I came from Fresno to support the AB 1726.
Thank you.
We are non Ziva, Kuto Fresno, Kuto Sajai Kosha and Goto.
My name is Nutia Veng. I came from Fresno to support the AB 1726.
Thank you.
Frank Yang from Fresno, California. I strongly support AB 1726. Thank you.
Thank you.
Hi, my name is Lee. I'm the Parent Engagement Coordinator for Stone Soup Fresno, and I'm here to support AB 1726. Thank you.
Thank you.
Good afternoon. I'm Lowell Enns. I'm the Executive Director of Stone Soup in Fresno, and I'm strong support of AB 1726.
Thank you.
I'm Imelda Plasencia with the Latino Coalition for a Healthy California, and we are in support of AB 1726.
Thank you.
Hello, my name is Katia Lopez, and I'm from the Coachella Valley, and I support AB 1726. Thank you.
Hello, my name is Juan Berdine. I'm from LA, and I also support 1726.
Thank you.
Kat New on behalf of Asian Americans Advancing Justice California in support.
Thank you.
Tam Ma on behalf of Health Access California in support.
Thank you.
Talofa Mabuhay, Ni Hao, and
Hola, my name is Lulu Amante. I represent the California State Student Association Empowered Pacific Islanders community, as well as associated students at San Jose State University, notably as the first API female president of our 117 years at San Jose State University. Thank you.
Thank you.
Dominic McIver on behalf of Children's Defense Fund California and support.
Thank you.
Michael Radigan on behalf of the Board of Supervisors, Santa Clara County, and support.
Great. Thank you.
Good afternoon. My name is Simon. I'm the first of my family to graduate college, and I support the bill.
Thank you.
Good morning. Rod Liu, Asian Pacific Partners for Empowerment, Advocacy, and Leadership. We strongly support 1726. Thank you.
Great. Thank you very much. Anyone here to speak in opposition? Anyone in between? Seeing no one, bring it back to the committee. I'm sorry.
Dear honored committee member, my name is Miao Liu. I'm a Fremont resident. I am associated with Silicon Valley Chinese Association. It's my honor to be here to present my opposition to Bill AB 1726. With all the sounding good intention of this bill, I find it confusing, unscientific, and racially divisive. First of all, I would like to respond to Mr. Bonter's public opinion on March 29 about Chinese and hepatitis B. I would like to make everyone in this room be aware that hepatitis B is not only on Asians. All the American babies born in this land, the first few of the immunization shots, one of it is hepatitis B. So, Chinese Americans here are not highly accessible to hepatitis B. I want to make that aware to the public. And as a woman, I'm very concerned of my own well-being. I also concerned about breast cancer. I read a research that showed Chinese immigrants, Japanese immigrants, or Filipino immigrants, when they first came into the United States, the incidence ratio to breast cancer are very high as compared to the counterparts in their home country. But down in the generations, first or second and further, all these women are having the same ratio as the rest of the American women. I found this data collection very unscientific. Thank you so much.
And just so you know, we have two speakers, and then anybody else's support just saying their name and their opposition, their name and their opposition to the measure. So we do have time for one more speaker.
Okay. My name is Daniel Liu. I'm a Fremont resident, citizen for 20 years. I'm here to move you to kill AB 1726 because it's based on racial and not scientific and waste of public resource. The first thing I want you to kill AB 1726 because Mr. Banta said specific ethnic group have specific disease. And this bill going to help the minority people. Then I want you to extend the bill to all American, to white, black, Latino, and Asians, not just to Asian people. If you just divided Asian people, then you are discriminate white, black, and Latino peoples. Second, I think this bill is not scientific. Myself, I'm a Hmong Chinese. So which group are you going to put me on? I can tell you that in the world, there are 1.4 billion Chinese have Hmong blood. The third, this bill should not include educations. So because Mr. Banta said he just care about the minority health information, so it should just focus on the health information. So please do not collect the education information. If you collect education information, it's just waste public resource. The final thing, I doubt the real intentions of the bill. If this bill really care about the disease control, Mr. Banta should cooperate with the CDC disease control, but he is not. Thank you.
Okay, thank you. Just your name and organization and position, please.
Oh, sorry. I'm Derek. I drive 2 hours from Silicon Valley, and I'm against the AB 1726, and I'm member of SVCA, Silicon Valley Chinese Association. Thank you.
Thank you.
Yeah, I'm Susan Zhang. I'm against Bill AB 1726. I'm come from San Mateo County, and I'm a member of SVCA. Thank you.
Thank you.
My name is Sui Fan Liu. We against Bill AB 1726. I am member of SVCA. I'm from Sacramento. Thank you.
Thank you.
My name is Wennan Guo, and I'm from Sunnyvale. And I'm a member with SVCA, and I'm against the bill AB 1726.
Thank you.
And this is my daughter, Emily.
I'm Emily. I'm from Sunnyvale, and I'm from SMS, and I'm also against this.
Great.
And she's from Sunnyvale Middle School. Thank you.
Thank you very much. Bringing it back, questions or comments from the committee? Ms. Waldron.
Thank you, Mr. Chair. I participated in a Northern Health Reform Convention last week, I think it was. Time goes by so fast. And one of the things I was looking at, because it was about new technologies and trends that the healthcare industry would be facing, and one of them that I particularly was interested in was what they call the new technology of population health management. And as you know, we on Health Committee are going to be seeing more and more and more of this, because basically it's a proactive application to define groups of individuals across the continuum of healthcare, so that there's an effort to maintain or improve the health of individuals within the group at the lowest necessary cost, using the data, mixing it up so that the results of all the data are put together in one place, and that health systems should know more about their patients that they serve, and success will depend on a combination of three things that I learned about, which, this is part of it, but we'll be seeing more and more. And the three things are technology, which is the data, and then the deployment, so the execution once you have that data, and then the content, which would be the clinical knowledge, all put together. And a medical center that uses this approach to drive preventative care will actually achieve lower population health costs and then better outcomes for the patient. So I think the more we know about our patients, the better.
Thank you, Ms. Waldron. I entirely agree. Thank you.
Any other questions from the committee?
Yes.
Yes, Mr. Ridley Thomas.
Mr. Banta, I'm sorry I didn't hear your opening. Seems like there's a lot of opposition, and what's the point of contention? Because this was we voted on something similar to this last year. Aside from the governor's veto, are there any changes that address the issue? Is it more likely that this is going to pass? What's going on?
Thank you, Mr. Ridley Thomas. You're absolutely right. There was a similar bill last year, AB 176, that flew through both houses, literally unanimous support in the Senate, near unanimous support in the Assembly, all but one of the members voted for it, and then it got to the governor's desk, and then he vetoed it. And he had an interesting veto message, which at once expressed the importance of collecting data and ethnic and racial information, but also some concerns. One of his concerns included the fact that we were rolling out and implementing the program over multiple years, and he thought it was too far down the road, so we've addressed that, and we're implementing faster in this bill. That's the only real change. All of the other categories for collection are the same. We're only working in the education space, the 3 segments of higher ed, as well as health. We've changed the health collection agencies a little bit. Last year we had DMHC as one of the collection agencies. This year it's DHCS and DPH only. So minor changes. The core of the bill is essentially exactly the same.
So, with the bill is some of the concern of opponents that the bill would disadvantage some subgroups of the API category because if you have a different health outcomes, let's say worse health outcomes for some of the group of API broadly defined, right now, maybe that's going through the same funding streams on a general category, that might have greater data might mean different funding schemes. Is that the underlying issue? We didn't talk about that at the time, but I don't know if this has raised a concern.
Right.
So people would lose resources maybe? Is that what the issue is?
I think the opponents certainly speak best for themselves in terms of what their concerns are. But what I've heard, as I've understood it, some have principled opposition to collection of any racial categories. And that's just going to have to be something we'll differ on.
Okay.
They'll be differing with the United States Census and the federal government, the state of California in so many ways on that issue.
Okay.
So I don't know what we can do about that. I think there is concern about where the data leads next. This bill is exclusively and entirely and 100% about collection of data. It makes no prejudgment or nor does it give direction as to what the solutions are. But it does say it's important to have solutions based on data, solutions based on evidence, and that when you know more, as Ms. Waldron just said, you can shape better solutions. And so I think there might be a concern about the fact that this data may show that certain communities have disparate outcomes in health and education, that they may get resources, but I don't think this should be seen as a fight for scraps.
So if this were to be passed again by both houses and enacted, the data itself, in your opinion, as you read the bill, would not necessarily change funding schemes and the like. We don't have automatic triggers because some of this is formulaic in some of our spending programs, particularly those that come through the federal government where the state is a pass-through. That's not an interest, concern, or point that you think is relevant on this? Data will not immediately impact kind of outside of legislative oversight and deliberation?
That's my understanding. It will not pull any triggers for any policy changes or resource allocation in different ways. The only resources that it would commit would be the resources to be able to collect and share the data.
Okay.
That's it. And then we'll all be able to have a discussion at the appropriate time about where that data leads, if anywhere, and what solutions we seek to support as legislators, if any. But foundations might have some. Nonprofits might have some, and if the data is available to them, then they can make data-based decisions on where they want to go with their
resources. Last
resources.
question, Mr. Chair, and thank you for your indulgence. What groups do you believe stand to benefit from the disaggregation of data?
I think every group that is currently concealed in a larger aggregated monolithic group and is being rendered invisible because of the way the data is collected stands to gain, because you can get true information, and those are the ones that are in this bill: Bangladeshi, Hmong, Indonesian, Malaysian, Pakistani, Sri Lankan, Taiwanese, Thai, Fijian, and Tongan. Okay. We already collect data today for Chinese, Japanese, Filipino, Korean, Vietnamese, Asian, Indian, and others. And this just adds additional categories, some of our largest, fastest growing subpopulations in the state. I believe that they deserve to have a voice and to be counted as well.
Thank you very much, Mr. Bonta.
Thank you, Mr. Ridley Thomas.
Chair.
Okay, Mr. Chu.
We have a quorum, too.
We do have a quorum now, so we're going to, Madam Secretary, would you take the roll, please? before the quorum disappears.
Wood?
Aye, here.
Mainshine?
Here.
Bonilla? Burke?
Here.
Campos?
Here.
Chu?
Here.
DeBobne? Gomez? Hernandez? Lackey? Nazarian? Olson? Patterson? Ridley Thomas? Rodriguez?
Here.
Santiago?
Here.
Steinnorth? Thurmond? Waldron?
We have a quorum.
Second.
Mr. Chu.
Thank you, Mr. Chair. First of all, I want to thank all of you for the discussion around this bill, and I know that I think there's a little confusion among our committee about some of the more recent perspectives on this bill, because last year we did, as has been noted, this bill moved forward with unanimous support. We had a very public vetting of the bill. And I will also say, as the author did, that there were 50 Asian American organizations that had asked us to move this forward. And I think in the last couple of weeks, there has unfortunately been a bit of misunderstanding and confusion, particularly within certain segments of the Chinese community around this. And I should mention that I was initially asked over a year ago to support this bill by a Chinese organization in my district. And I think some of that confusion has come about related to topics that are not mentioned in this bill whatsoever. And I think that's unfortunate. What we have certainly seen is that data always helps. In fact, in San Francisco, when we collected and disaggregated data around different API ethnicities, we discovered so many parts of our community that had needs that we needed to address around poverty and inequality and healthcare. As I know the author has previously mentioned, as we've collected data for the Chinese community, this is data that has helped us to address the concerns of the Chinese community, whether it be with regards to healthcare or to social services or to education or to others. We know that data is agnostic. Collecting more information, collecting more facts can only help us address things, and it's always better, I think, to have more information so we can discuss what to do than have less. And so that is why I am happy to support this. I do hope that we'll be able to have more of an in-depth conversation about this in the future. But with that, along with others, happy to move this bill forward.
Okay. Any other questions or comments? Mr. Bonta, would you like to close?
Thank you, Mr. Chair and colleagues. Thank you for your discussion and your thoughts and your questions. I'll just end by saying there's nothing to fear from more data, from better data, from more accurate data, and there's a lot to gain, particularly for those communities who are going to be counted for the first time, but also for all of California. So I appreciate your consideration and respectfully ask for your aye vote.
Thank you very much. So we have a motion from Mr. Ridley Thomas, and there was a second, and I didn't catch who seconded. I'm sorry, it was Ms. Burke? Okay. So we have a motion and a second. We'll have a roll call vote, please, Madam Secretary.
Wood?
Aye.
Wood, aye. Mainshine? Mainshine, no. Bonilla? Burke? Aye. Burke, aye. Campos? Campos, aye. Chu? Aye. Chu, aye. DeBobne? Gomez? Hernandez? Lackey? Nazarian? Olson? Patterson? Patterson, no. Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez?
Here. Aye.
Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Thurmond? Waldron? Waldron, aye.
So, Mr. Bonta, you have 8 votes. You need 2 more. Two more. Well, it'd be nice to have 3, but whatever. So we have now we have a motion for the consent calendar.